I grew up on the south side of Chicago. We was there for about 15 years, and then we moved here to Grand Rapids. And from there, I ended up moving to a situation where that it wasn't comfortable for me, but I ended up going to a prison system, where that I ended up doing a B&E. The B&E turned into a murder. And from there, I ended up going through the juvenile system and the prison system. And they sentenced me to life in prison. And with the life in prison, I ended up doing 35 years. I have the support from the Grand Rapids prosecutor's office. Mr. Sawyer, he supported me getting out. He was head prosecutor, and he said that he never helped support anyone getting out of prison, and I was the best candidate for him to support. And my judge, Judge Snow, he moved on, and another judge that supported Sawyer's helped me get out, and my wife, she pretty much spearheaded it all. By me coming out of the system with the parole, I ended up getting involved with community work, as well as they had a called reentry, and I came out. I never was associated with the reentry, but they asked me to get involved with the reentry. And once I got involved with the reentry, I met Ralph Mason and Terry Dixon, and they ended up wanting me to be supportive with the inner city, working with different types of groups, and we came up with this group called CLEAR. CLEAR been running now for 14 years in Grand Rapids. It's a men's group, and we do a lot of interacting with the mind and the hearts of individuals that's coming out and making sure they have a support system. From there, that's where I try to keep my positivity around them guys, because they're in a profession and they in it for real. So if they doing real stuff, I want to do real stuff by helping the guys that come out of the system. And if they see me keeping it real, they would keep themselves real.
We had met through his sister. We were going to the same church, and she asked me to pray for her brother, realizing that I thought his brother was in town, but he wasn't. He was incarcerated. And from there, she had arranged everything for the phone call and everything, and I was really trying to get out of praying for him, because I was one of the leaders at the church, and I was really trying to get out. But she was making it so hard that she said, I'll pick you up, I'll do this, I'll do that. So, and I could, that's how we met. She came and got me and prayed for him.
Well, I have a lung problem called sarcoidosis, and I don't accept what they say COPD or something like that with the lungs. I didn't accept it, but I had every symptoms of it, and I try to do certain things with what I'm doing, because I was an athlete in the system, and I came out, I was still doing good and everything, and all of a sudden one day it just took a downfall. My sarcoidosis inflamed, my lungs had problems, and that's when I connected with my wife's plan with Dr. Whaling.
Well, me, myself, I love being a patient at Catherine's, because due to the fact when you had a crisis, emergencies, they got back with you in a timely fashion. They seemed sincere, and I believe that they were sincere with me, through my health care. They told you the pros and the cons, and they didn't mind taking time. But you don't find that much of today. Everything is hurry up and rush out, or you got to be there on time, and there's no time when you get in the room. That's what I have found out, being a patient at other places.
Ross is somebody that has worked really hard at being healthy, and Ross is somebody that is an active participant in his care. He's somebody that has risen to the occasion and really excels when he's given the opportunity to be a leader in his own health care. Through coming through his appointments, through partnering with us in health care, he's gotten his chronic conditions to a place where he has quality of life, where he's able to find joy in life and participate in the things that bring him joy and purpose and allow him to give back to the community. Yeah, but Ross is a joy to work with. He's somebody that when he walks into the room, you feel it and you know it. He's engaged in his health care. He asks thoughtful questions. And again, I think if just by giving him the space, giving him the tools, giving him the chance to regain his health, been a really powerful experience for him. I know about your healthcare journey. Like I see the chart, I see Dr. Whalen's notes, I see Deborah's notes. So I know, like I knew you from a health perspective, but I didn't know that really powerful personal story you have. And, I did some reading on that recently because, you've been for Catherine so long, and I think a lot of people here know it, but I didn't know that story. And I think getting the chance to know you on that level helps me understand you better, where you're coming from better, and I also think how I can provide care for you better. And I really appreciate you giving me the opportunity to participate in your healthcare, because you're right, change is hard, and change for people that have been through what you've been through is incredibly hard. And I'm glad that Catherine's can create a space for you to feel safe, feel trusting, and despite the change in providers, you can continue to get what you need so you can be healthy and do that really neat work that you're doing in the community.